Research is fundamentally important to us at the Thyroid Eye Disease Center. It's the reason why we think we can offer patients hope and a difference for the future. Our laboratory has been very interested in the causes of thyroid eye disease and what we can do to treat it. We've identified in the past a new receptor that is to the insulin-like growth factor 1 receptor. The short name for it is the IGF-1 receptor. The body attacks this receptor in addition to another receptor called the TSH receptor. The TSH receptor is the one that causes the hyperthyroidism that most people associate with the disease. It's the body's response to these two receptors that seems to be fundamentally important for the disease to occur and for the severity of the eye disease. We've known that this receptor, the IGF-1 receptor, is overexpressed in a variety of tissues, including the orbit. What we've more recently identified is that the tissues in the orbit actually come from the bone marrow. The bone marrow is activated and the immune system is activated to both of these receptors and sends cells to the orbit or to the eye muscles and fat that causes the swelling seen in thyroid eye disease. And our laboratory has been very interested in the causes of this and, more importantly, how to stop or prevent this progression. The upshot of this is that we've been able to work with a company and develop a clinical trial. It's the largest clinical trial ever conducted in the United States for a biologic intervention in this disease. It encompasses international sites, approximately 25 sites in total, and it's designed to see if we can't interfere with the disease process. So what happens is that the immune system normally would attack the eye tissue and the thyroid based upon the identification of these receptors. They're the marker that the immune system knows to attack in these two particular tissues that cause the disease. What we've done with the help of this company is to make an antibody that blocks or masks this receptor, the IGF-1 receptor, to the immune system. And it so happens that it also seems to block the interaction of the other receptor, the TSH receptor, too. The end result of this is that the immune system doesn't seem to be able to recognize these receptors. And instead of producing lots of cytokines and other immune inflammatory products, it instead goes about its merry way and doesn't infiltrate into the orbit. At least that's our hope, and that's what we're actively testing and evaluating right now. And that's probably the most exciting area of new research because it offers hope to patients to potentially cure the disease and even potentially reverse the effects of the disease, reverse the effects of the eye bulging and the double vision that can occur and are so fundamentally problematic in this disease. At the Thyroid Eye Disease Center, we're very interested in clinical research. Clinical research has a direct application to patients in that it can help guide our treatment and care for so many patients and affect so many people. We've been very interested in determining why some patients progress from having Graves' disease or just the thyroid component of the disease to getting thyroid eye disease. So we did a very large study where we looked at several million people and looked at why and some of the things that they do that could lead from getting Graves' disease or just the thyroid component of the disease to then getting the eye disease. And we found some very surprising results that we've just recently published. One is that thyroidectomy, or removal of the thyroid gland, at least during the phase, in the early phase of the disease, the phase that is when the thyroid gland is most effective, is very beneficial and reduces the risk of going on and developing the eye disease. The second thing that we've found is that the use of statins, or taking statins for high cholesterol, high lipid, can dramatically decrease the chance that you'll end up getting thyroid eye disease. This research allows us to potentially change the course of someone's disease or prevent them from getting the disease at all. We have to prove these things through prospective studies, which are required and certainly will need to be validated, but this really gives us hope that we can change a patient's course and improve their outcome. The research that we're doing here is quite diverse and hopefully is going to be quite impactful for patients and for patient care. And we look forward to the future because we certainly think that it's going to be a bright and dynamic future for all of our patients. We've been fortunate to establish a new research fund called TED-Cure, where we hope to really propel the research that has been ongoing in our laboratory toward clinical trials and toward investigation that will hopefully cure the disease. This is an exciting time because for the first time in many years, there are many areas in which we can expand and move forward to identify novel treatments for patients.